The following audio-supported podcast is intended for informational and educational purposes only and is not intended as medical advice. Please speak with your healthcare professional before making any treatment decisions. The guests on today's show were paid to participate in this podcast.
Welcome back to Just Listen, Voices of PK Deficiency. I'm your host, Dr. Rachel Grace. I'm pleased to welcome back Tamara Shriver to today's podcast. Dr. Shriver is a patient advocate and president of the patient group Thrive with PK Deficiency and a registered dietitian. She's also the co-author of a comprehensive publication on nutrition and PK deficiency and another inherited hemolytic anemia, thalassemia. I'm looking forward to today's conversation focused on both the patient and dietitian perspective on why people with PK deficiency need to optimize nutrition and vitamins and optimize physical activity. Tamara, welcome to today's podcast.
Thank you. I'm glad to be here with you.
I thought we could start by talking about what is a registered dietitian and how do dietitians help people with PK deficiency?
Well, a registered dietitian nutritionist is somebody that has gone to school for dietetics for at least 4 years. And they just changed the requirements. So now you need to get a master's degree in nutrition. And then after you do that, you have typically some clinical work and you have to pass a national exam. So it's somebody that's trained in biology, chemistry, a lot of anatomy, and of course, nutrition. And then they're trained in how to approach the patient and how to create plans for the patient to optimize their health. And dietitians can work in a variety of settings. So they can work in hospitals, they can work in outpatient clinics, they can work in long-term facilities. They can also work in industry in helping design food products. They can work in public health in optimizing policy and guidelines for national food programs. So that is what a registered dietitian is. And it's different than what you see on the internet, which is a lot of people that recommend food based on their own experiences. People that are registered dietitian or registered nutritionist are people that have training in it and they have credentials and they have to keep up those credentials so that they're always on top of the science. And they have jobs in it and they're paid for what they do and they get reimbursed for seeing patients with different diseases.
Agios is a biopharmaceutical company that's fueled by connections with patient communities, healthcare professionals, partners, and each other. Building on these connections and the company's unmatched leadership in PK activation, Agios is pioneering therapies for rare blood disorders, including sickle cell disease, thalassemia, and PK deficiency. To learn more, visit us at agios.com. That's agios.com. To join the conversation with other patient allies, follow us on Instagram at Ally Voices Rising.
And how have you seen dietitians work with hematologists in your observations?
This is something that I am trying to advocate for more of, but there are people that have diseases like sickle cell disease, thalassemia, pyruvate kinase disease, and I would even add what is the disease where people have iron overload.
Hemochromatosis.
Yes, hemochromatosis, where the impact of iron on your diet iron overload. So anemia is one thing, and that's what people feel the most when you have those sorts of diseases. And an iron overload, that's a little bit different. But what people with hemolytic anemias really suffer with is the secondary impacts of iron overload. And so knowing how to manage that properly, there's a lot of misinformation about it. And so going to a registered dietitian to get the right information about it, this is important when you're a child and important when you're an adult, and setting up an eating plan that works for you specifically in the country that you live in, the types of foods that you have, what you're economically available to purchase, what you have access to. It's important to see a registered dietitian so you can have that really lengthy discussion that sometimes hematologists might not have that time. So what I'm trying to advocate for is for hematologists to make referrals to registered dietitians to have those discussions, and also to include if there's any comorbidities. Let's say there's diabetes or osteoporosis or liver disease or heart disease, to include those in the referral to the dietitian. That's how hematologists can work with dietitians. It's important to make those referrals in order to get them covered by insurance.
For people who have PK deficiency who are listening, what would a registered dietitian think about for them?
Immediately, what they would talk about is iron overload. And then I think also just their energy. They would look at whether or not they have where they are on the growth chart. Are they getting the right amount of calories, and are the calories nutrient dense? So in other words, you may be eating too few or too many calories. So there could be an adjustment there. But more importantly, are the calories that you are eating, are they full of, we want to make sure that they're full of zinc and protein, calcium, some of the key nutrients that are important for people with PKD. So making sure you have nutrient dense calories as opposed to junk food. Everybody likes junk food and eats junk food, and it's okay to have a little bit of junk food in your diet, but we want to take a look at exactly how much you're eating and see if we can swap out some of the junk food for some more what we call nutrient dense foods. So maybe foods like a whole grain bread, or better choices of lean proteins instead of pepperoni, maybe a lean meat of chicken or something like that. Looking at your calories, are they nutrient dense? And then secondly, iron, which we can talk about iron overload if you want. Those are pretty much the big two for PKD, but your overall diet quality for sure. And then if you had any comorbidities.
You were mentioning too about other vitamins like zinc. How would people modify their diets or think about their diets to make sure they're getting enough of some of the micronutrients that they need?
So this is usually what happens when you go into a dietitian. First of all, a dietitian will ask you for a dietary recall. So might be 2 days, it might be 3 days, but if they don't send you the paperwork in advance, you will spend the first little time with them talking about what is it that you have eaten. And you might fill out a food frequency questionnaire talking about how often you eat certain foods. So a dietitian is trying to get a sense of what foods you eat and what foods you don't eat. And by determining what foods you eat, he or she will figure out, are you eating foods that are nutrient dense? And then the foods that you aren't eating. So let's say, for example, when I was doing this, I would quickly figure out, are you deficient in foods that are orange colored, that are fruits and vegetables? Because orange colored fruits and vegetables have lycopene, vitamin A. Or are you deficient in proteins, which carry zinc and selenium? They're looking basically for food groups that you're deficient in. Dairy, are you lean dairy or calcium sources? If you are vegan, are you deficient in whole grains? And so that's the area that we're doing an assessment, because we know that those big groups contain essential nutrients like protein, zinc, vitamin B, folate, B12. And we can do a pretty quick assessment to determine if there's areas of concern. And then once we determine that there's areas of concern, and we've also determined what your calorie levels are, then we try to set up an eating plan based on your calorie levels. So let's say you just need to maintain weight and you're a female. So we know we need about 18 to 2,000 calories. So now we're going to set up an eating plan based on 18 to 2,000 calories, but really set something up that has foods you like or your child likes at their calorie level that has those foods that, let's say you don't like protein, you're a vegan or you're a vegetarian, and I've got to figure out ways to get B12, zinc, and some other B vitamins in you. So then we're going to talk for a long time about different foods that we can plug into your diet that have those nutrients. And that's what a comprehensive nutritionist will do for you. And maybe there's not foods. At the end of that, we might end up with recommendations for supplements. Or what we might do is say, let's see if we can get the doctor to order some blood tests to see how your blood levels on B12 or vitamin D, which is another really important vitamin, are at, or calcium levels, before we go ahead and do supplements. But that's like a pretty big picture of what sitting down with what a dietitian looks like.
And thinking about supplements, do you feel as a registered dietitian that people who have hemolytic anemias like pyruvate kinase deficiency should be on vitamins, should be taking vitamins in addition to what they're getting through their diet to ensure they're getting certain key vitamins?
There are some supplements that we do think that people with PKD should take. And first of all, folate, which most people are on folate because of recommendations. They're just traditionally there, and doctors have recommended that. And then also vitamin D. Typically, most people, whether they have PKD or not, don't get enough vitamin D. So we have recommendations for vitamin D. And I would love it if every single person ate a perfect diet, but there's like only maybe 5% of the population that eats a perfect diet. So we do recommend a multivitamin that doesn't have iron. And you can generally find those men's multivitamins don't have iron, so that's typically where you can find those. And that's the same for children. It's really hard. It's tricky to find a multivitamin without iron, so we would recommend that. And then beyond that, I go down into, I really want to work hard to make sure that the person that I'm working with is getting enough sources of calcium, is eating enough source of calcium. Because the nice thing about calcium is when it naturally occurs, it typically occurs in the right amount and in the right matrix for absorption. But if the person is not eating a rich calcium diet, or they're absorbing, or it's partially rich diet, then I might recommend a calcium supplement, but only up to about 500 milligrams a day, because anything beyond that can really trigger renal problems. And then I would also tell your doctor about any supplements that you're taking so that your doctor can monitor that also. But those are the big ones before doing anything else. After that, I would really recommend food first.
You mentioned about vitamin D and calcium, and that's so important for people to think about who have pyruvate kinase deficiency, because there is this higher rate of osteoporosis and osteopenia than in the general population. And it seems to occur also at younger ages than in healthy individuals.
Yeah, thank you for putting that context around there. Thank you.
What advice would you have about people's habits starting at a young age in terms of their diet and physical activity, in terms of trying to avoid issues of low bone density as much as possible? And should people, you had mentioned about vitamin D and calcium and the maybe problems related to calcium supplements and thinking about dietary calcium, what kind of specific advice would you give people, and starting at what age in terms of thinking about?
If it's at all possible, I would, if you can breastfeed for as long as possible, I think breastfeeding, or I just think that's really beneficial in terms of bone health and physical activity. And I know that as a parent, so we're touching on issues around parenting more than we are about health. So this can be a really difficult topic to talk about, but at a young age, a child's diet is really reflective of the family's diet. One thing that I would really talk about is breast milk, if possible, as long as possible. And then also when you start to make the transition into other fluids other than breast milk or formula, to really limit the amount of juice, 100% juice. So children really only need a cup of juice. That's plenty of vitamin C, and really to avoid any other beverages other than water. So just to make it a habit that it's milk or juice. You really don't need electrolyte beverages for young children. You don't need all these other like lemonade or juice drinks. Kids just don't need that. Their teeth don't need that. Their body doesn't need it. And so what I get concerned about as a dietitian is that as you introduce other flavors of beverages, it replaces the desire for milk. And milk should really be the primary beverage that they're consuming as long as you possibly can. And I do mean until like teenagehood, just to help build the bones in children. And it's so important in people that have PKD because we struggle with osteoporosis and osteopenia at a very early age. And when I say milk, dairy milk, not soy milks are better. Soy milks have protein and they're fortified with calcium and vitamin D, but any sort of milks, not oat milk, but milk that has protein, calcium, and vitamin D. Those three things are really important for building bone density and making sure that the fluid that they're drinking is milk or water for as long as you possibly can. And that snacks be yogurt and cheese for as long as you possibly can. And if you have a child that is lactose intolerant, that you introduce Lactaid or other options that you can really work on. And that's where you get a dietitian to help with those calcium building nutrients and really early on for as long as possible and really limit the other beverage options. And this is hard because when you take them to grandparents, really want to give them like all these fun pops and sodas because they're grandparents and you have to say, no, give them chocolate milk. Chocolate milk is totally fine. Strawberry milk is fine, whatever, but it's just so important to build bone density in children.
And in thinking about building strong bones, you mentioned already about vitamin D and how most people are vitamin D deficient, just related to exposure to the sun, especially in the Northeast in the US where I am. And so do you recommend that everybody with PK deficiency take vitamin D?
I do. I do recommend that. With the guidance of their physician, I do recommend that they take vitamin D. And there's vitamin D drops for children that make it a little bit easier. And I know I'm speaking to a pediatrician, so I feel like an imposter here, but I do recommend that with the guidance of their physician that people with PKD take vitamin D because of the importance of the absorption. It helps absorb calcium, which lays into the bone matrix better. So it's really important for vitamin D and calcium to go together and as early as possible for as long as possible.
And the new PK Deficiency International Guidelines also recommend vitamin D level monitoring in people who don't take vitamin D. If you take vitamin D, then potentially get out of that monitoring.
Yeah, exactly. And it may be too, I think this is totally fair to say, there may be periods in your life where you don't need to take vitamin D if you've done a really good job. And I say job loosely because your genetics, you may have periods of time where your bones are doing fine, and then periods of time where your bones or your vitamin D levels and calcium levels aren't as high as they should be. But the key is the monitoring and then being really aggressive in treatment. And you just don't want to have fractures and osteoporosis at a young age because it slows you down. And the other key ingredient is physical activity. So I was getting to that. Sometimes I see parents slowing their kids down because they're concerned about their children being fatigued, and it's a valid concern. But I think that if your child has a self-monitor, and if they're still physically active and they're safe and they're not tripping and falling down, but they're still able to move, that's a good thing for their bones. I would encourage that you let them run around as long as they are able to. And people with PKD have various levels of activity. Some can move quite a lot and some don't, but generally they will show that by their behavior. So I think as a parent, you just have to watch that as long as they're moving and they're not causing themselves harm, it's a good thing.
Too, that's good advice for any age, not just for children, in terms of physical activity and gauging your energy level for what you're able to do, but maintaining muscle strength and strong bones. You want to continue with physical activity on a regular basis at every age.
Yeah, and I'll add on to that, as an adult, it gets a little bit more difficult if as you age, you don't feel as good. And I think sometimes then you stop moving. And I've set the personal goal, and a lot of us that are older have talked about it, but the goal is to move more than yesterday. So if you're in the situation where you're not moving, maybe it's like, I'm going to go up and down steps. I didn't yesterday, but today I'm going to go up and down steps. So it's just trying to keep your muscles active and moving more than yesterday. The people who are already active, that's great. You keep doing that. But for those of us that are becoming sedentary, you just have to find ways to increase your activity. And I'm joking, but I say maybe it's getting up from the couch more often than you might have. But it is so important to keep muscles moving and get a pet that demands being walked, whatever you can to just keep moving. And it's important for muscles and then, of course, bones, to get the weight on the bones to help them build.
You mentioned already about iron and PK deficiency and in hemolytic anemias, and we discuss that all the time in people with PK deficiency because of iron overload, which affects so many people. And I wondered if you could talk a bit about how people with PK deficiency should think about their diet and iron in their diet and the management of iron overload.
Yeah, I do think that's really important because there is a lot of sort of misinformation floating out around in the community about iron overload. I know that there's sort of like this, I think that what is going on in the community is that people think that they need to avoid iron-containing foods and they feel guilty whenever they eat something that's healthy for them that has iron. And then there's the other school of thought that's so burdensome. I don't know what to do with it, so I'm going to do nothing. So let's break it down. Who needs to worry about iron and at what level? First of all, if you are being chelated, you really don't need to worry about avoiding iron. So that's really simple because the amount of iron that is coming in through your diet is minor compared to what's coming in through transfusions and naturally. So just if you're on chelation therapy, that chelation therapy will take care of it. Now, with that said, let's make sure that you're managing your chelation therapy and that you're on that therapy. And if you're not, then it's really important to talk to your doctor to work out a plan that works for you. And I know that there are people that are not successful with their chelation plan. So I urge you to talk to your doctor about that. And part of that can be nausea from chelation, and some of the things that we have found is just making sure that you drink a lot of fluid throughout the day. That can really help with absorbing the chelator, or eating a big meal along the same time that you take the chelator, but of course follow the directions of the chelator. But that can sometimes minimize the nausea. I know that there are medications to go along with nausea. So I encourage you to work with your physician on that because it's so important to be on that chelator medicine. So for people that are not transfused, what we recommend is that you avoid iron from red meat. So that's really the only thing. And I would say red meat, I love steak. Okay, but you probably don't eat steak every night, I'm guessing. You still can have those foods, just not frequently. We would recommend just limiting the number of times that you're having those animal sources of red meat, also processed meat and blood-containing foods. So there are some foods that are traditionally blood-containing foods, so really limit those. Basically, just red meat and blood-containing foods. Don't avoid iron-containing fruits and vegetables like spinach. And there's a lot of really good fruits and vegetables legumes that have iron. Don't avoid those foods because they're plant-based, so they're not absorbed as well. And they do so many beneficial things for your body. The amount of iron that absorbs from them is very tiny. And so to avoid those foods, you're actually hurting yourself. So that's pretty much the rule of thumb.
What advice do you give around vitamin C, which increases your absorption of iron?
A funny thing about vitamin C is there was one study done with people with PKD and vitamin C, and it was shown that people with PKD and vitamin C actually have lower levels of vitamin C. lower plasma levels of vitamin C. So it's the same theory that I don't recommend that people avoid vitamin C because of it's an antioxidant, first of all. And so people that have higher iron levels have more free radicals, and we need those antioxidants from vitamin C to squelch the oxidants. I recommend not avoiding vitamin C. Plus, vitamin C is really important for immunity and several other things. Don't avoid oranges. Don't avoid citrus fruit. At the same time, don't fry with a cast iron pan, which increases the amount of iron in your diet. So don't add it, but don't avoid it is the rule of thumb. There are some foods that actually interfere with iron absorption. So, for example, tea. And tea is a really nice beverage and this is for adults, not for children, but tea is a nice beverage to drink along with your meal to decrease the absorption of iron. And then soy proteins, which they also decrease the absorption of iron, coffee, red wine, egg proteins. So you certainly can make scrambled eggs for your child or yourself, and then cocoa from chocolate. So all of those things interfere with iron absorption and are good foods to eat, or to focus on if you're worried about iron absorption. And then within tea, black tea has the strongest property, then green tea, and then other teas.
Cow's milk also decreases your absorption of iron, is in terms of your other recommendations about drinking water and milk.
Exactly, 100%. Another reason to drink milk, water and milk.
I think that the complexities around iron, dietary iron, vitamin C intake are incredibly important to talk about for patients with their hematologist. And another reason to include a registered dietitian in the conversation for an individual patient who may be on chelation or another person who may be not on chelation, that the recommendations about what to do in terms of diet may be different. And hematologists and the dietitian would be especially attuned to vitamin C intake, and is that going to impact chelation and iron? And so I think this really speaks to the need for the team approach that you were discussing earlier in terms of involving the dietitian.
And the other thing that I've learned from the thalassemia community is that sometimes they need to take vitamin C. And I don't know if that's the same with the PKD community. I would leave that to the hematologist. So it's further proof that we don't need to avoid vitamin C. And I know that's tricky because that's not the way it is with iron deficiency anemia, which is the opposite of what we have.
As pediatricians, we think about growth all the time in children and are monitoring growth very carefully, particularly in kids who have anemia and sometimes have restrictive diets because they're very picky. I wondered what suggestions you have for parents of children who are picky, and as they're listening, here are your recommendations around calcium-containing foods and other nutrients that are needed from the diet.
So as a dietitian, we often work with parents that have picky eaters. And picky eaters can be really challenging. I have had a child who is a picky eater, so I do understand how challenging this is, because on one hand, you want them to be their own little human. And on the other hand, you're so desperate for them to eat that you'll just let them eat anything because you are so worried about them being undernourished that you don't even care about their nutritional status. So there's a sort of an expert in the field of nutrition. Her name is Ellen Satter, and she has the division of responsibility in feeding. And I'm going to read it and then I'll explain it to you. But she says that the parent is responsible for what, when, and where a child eats, and the child is responsible for how much they're going to eat and whether they're going to eat. So she believes that children will not starve themselves and that they eat as much as they want and they stop when they want. And that really parents should decide what a child is going to eat and what time. And I'm a tiny little bit more gracious than she is because I was really worried about my picky eater. So these are some of the tips that I've worked on along with the co-author of this book, which is Ellen Fung. And I need to give her credit for working on this book. The first thing I will say is your picky eater will surprise you with what they will eat. So never think that your picky eater is going to not like something that you don't like. So always offer them something, always. I, for some reason, thought my picky eater, wasn't going to like hummus, and she loves it, and it's one of her 10 foods that she eats. She's almost 19, and she eats hummus, and that's one of her 10 foods. And thankfully, hummus is a healthy food. So that's the other thing. Don't think your picky eater is not going to like a healthy food, because it could be a healthy food that they like. And then also, especially if it's a healthy food, make that healthy food available. Always have it available for them. We have a rule that we experience new foods. We always try new things, because I don't know if she's going to like it or not. She doesn't have to try it, but who knows? She might try it and she might like it. And now it might be one of 11th food that she likes. So the rule is, when possible, offer different foods. You never know, the picky eater might like it. So when you do offer new foods, make sure that there's a familiar food. So that hummus, we always make sure that hummus is available, or one of the other on the 10 items that's liked. Don't give up. Do not give up. I think there's a lot that has to do with familiarity. So just keep trying. Just bring it out. This is normal. This is absolutely normal. People all over the world eat this. And someday you might like it. So just bring it out, but also have that backup food available just in case they don't like it. And also, don't make a big deal about it. Just don't make a fuss at meals time. Do not make mealtime a battle. I've seen so many people make mealtime and food, tiny little specks of food, battles. Don't. There's other things to battle about. Food is not where there should be battles. Provide regular meals and snacks. If they don't eat at that one particular meal or snack, they know another meal or snack is coming up. So just have them at predictable times, and they know that at that predictable time will be a meal or snack. Make meal times pleasant. And use the same plates, the same utensils, the same location, just so that's very predictable. Sometimes kids just like predictability. Avoid distractions like phones, iPads, computers, TVs, and then eat together as much as you can and make it a really pleasant time. It's just supposed to be fun. No yelling, no, you should do your homework, none of that. Don't take on life's big challenges at the table. Just don't. And then as a parent, model healthy food choices. And this is a really hard one. And this is where a lot of times we get into family counseling, because, there's a lot of behaviors and parents recognize this. They recognize that they have their own behaviors, and they're bringing those behaviors to the family. And whether you like it or not, you're a role model of eating. And so sometimes we have to address family or parent behaviors. And then food shouldn't be a reward or a punishment, never a reward or a punishment. It can be for special occasions, but never use it as a reward or punishment. And then food shouldn't be stigmatized as good or bad. Food is it can be a always food, a sometimes food, or a never food. So a always food is foods that we eat because they're foods from the rainbow. They're nutrient dense, they're lots of color, they have lots of good healthy stuff that comes in our body. And sometimes foods are like what you and I would call junk food, but we just enjoy them sometimes. And never foods are foods that we're allergic to, or maybe somebody has a religious belief that they don't eat it, or if you have, maybe you're vegan or vegetarian, and those would be never foods. So it's just really about having a healthy attitude, and then a little bit of permission to let your picky eater have foods that they always like at the meal, and then a new food to check out, because we really want that person to grow, and we want to make sure that they have some food at every meal, but then also the opportunity to inspect new foods to include in their repertoire. I will say also, there are a lot of kids that have sensory issues. And so that's a little bit why new foods are scary. And so as they get older, they get over some of those sensory issues. And so just give them the time to get over sensory issues.
That's really helpful. That's helpful for everybody. I think not specific to people with hemolytic anemias, but general great advice. So thank you so much for that. I think people listening may be wondering, they see their hematologist regularly, and it's never been mentioned that they should consider seeing a dietitian. And people may be wondering, how do they go about asking to see a dietitian? And is a registered dietitian the same as a nutritionist, or should they be asking for one or the other for a specific reason?
The terminology is tricky. A registered dietitian is the same as a registered nutritionist in the United States. The registered dietitian is sort of the more traditional term, and it's a term that's used in other countries. And you can ask your hematologist for an appointment. And I know people are a little bit shy about asking about it because they feel like they need to have a reason. And so sometimes I will just say the reason is you just, obviously you just want to have a healthier diet, but for insurance purposes, you need to have a reason. And so some of the reasons you could say there might be malnutrition or undernutrition or improper growth or diabetes, or you can definitely get insurance. There's a list of codes. And so I would look at the codes that if you're on Medicare or Medicaid, those are the codes that a physician can write to see a dietitian. And so I don't know that a patient would know those codes, but they're generally for weight gain, weight loss, any medical comorbidity, MNT, which is medical nutrition therapy. And then I don't think there's anything specific for anemia, but within just the guidelines of you're trying to rule out also disordered eating. Those are some of the other reasons. When I worked in WIC, I worked in the Women, Infant, Children's program. I was always able to find a reason within the options of why I could code somebody or determine a reason for. Nobody has perfect eating, is what I'm saying. And I could always find a reason for why they needed to see a dietitian.
Tamara, thank you so much for sharing all this information and advice about diet and physical activity in general, and in particular in people with PK deficiency. This was an extremely helpful conversation, and I know the listeners will learn a lot from this. So thank you so much.
I am really grateful to be able to speak with you because you are an awesome hematologist. So it is equally an honor for me.
Thanks for listening to Just Listen, Voices of Pyruvate Kinase Deficiency. Don't forget to hit that follow button in your favorite podcast app so you don't miss an episode. Share the show with members of the PK Deficiency community. And if you'd like to learn more about PK Deficiency and see what resources there are to support people impacted by PK Deficiency, visit knowpkdeficiency.com. That is knowpkdeficiency.com. Thanks for listening. I'm Dr. Rachel Grace, and we look forward to talking with you again.